I think whenever we have a new therapy for disease, for me as a clinician, I always worry about access.
We want to improve access for patients that have been disadvantaged or marginalized in our community.
Our mission is to provide the best clinical care to all patients.
American Thoracic Society members around the world are determined to improve access to care and reduce health inequities.
Getting the patients access to the right treatments matters.
Socioeconomic factors are probably the biggest root cause of inequalities in healthcare.
I'm glad to say that the American Thoracic Society, especially in the last 10 years, has taken a very active position limiting air pollution and definitely limiting exposure to cigarette smoke and vaping.
Some of the key risk factors in chronic respiratory diseases.
If we address these inequities in these risk factors, we would have a major impact in reducing the burden of respiratory diseases, particularly among the poor and, in this country, racial and ethnic minorities.
I think with the focus and with the energy that's associated with many of us who work on this space, I think we'll be able to do important things.
Tobacco and smoking are a particular focus.
Tobacco control is a lovely prism that can identify all sorts of disparities. And that's why I love to talk about kind of tobacco control, because I don't think people recognize that it crosses over into all of those sectors where we see health disparities played out.
It's not enough to talk about it. We have to do something about it. But it begins with discussion so that we can understand the reasons for health disparities.
It's an all-in approach to achieving health equity.
And when I say equitable, I don't necessarily mean exactly the same. I mean healthcare that is adapted to be optimized for every patient. And that, I think, is really truly equity and justice in healthcare.
Digging deeper into environmental factors is part of the equation.
You know, I want to know more about the health effects of air pollution on different lung diseases that haven't really been looked at. I definitely want to delve more into healthcare inequalities or exposure inequalities.
Universities are actively addressing the lack of access that contribute to disparities.
It's something that I certainly think makes Stanford stand apart. We think quite a bit about anti-racism education and developing curricula that's going to support that. And then we also work a lot on community outreach.
The importance of improving access to care is that innovation doesn't do any good if it doesn't reach the people that need it.
My intrinsic belief is that healthcare, quality healthcare is a human right, and trying to make that quality healthcare that UCLA provides as accessible to as many of our population as possible is what drew me here.
This is a core value of our division. It's something that we find really important.
And so one of the things that we knew that we needed to do was expand the access to care here so that we could take better care of the underserved and uninsured folks that live in our area.
And so trying to break down those barriers has been a goal of ours at Vanderbilt.
As I said before, we're really purpose motivated. And so I can't think of a better purpose than saying, there's an equity issue here, right? We want to be able to get people the best possible care that they can at the right time.
I think that's the team at Penn is really what makes it special.
Groundbreaking technology is impacting access.
We are looking to bring a wave of disruption by providing an opportunity to shift the level of information, the access to that forward in a way that hasn't happened in 50 years.
Collaborations are helping to improve access.
We keep the patients at the center of everything we do at the CNC. And so anything I can do, however big or small, just really inspired me to step forward and just, take this on for just everyone out there suffering from any type of respiratory distress.
Really been my lifelong mission to make life better for our patients with COPD.
What we're doing is we're giving them not only their breath, but we're giving their dignity back.
And I don't think that we could be the best physicians if we really don't address health disparities and ensuring that care or excellence of care reach every patient.
It's going to require a consistent and thoughtful engagement at all arenas,
for us to be able to move the needle.
I believe there is a general motivation and will in this country and others to work together to put these inequities in the history books where they belong.